Well, children's hospitals across Canada are reporting an unusual increase in the number of walking pneumonia cases affecting young patients. For more on this, let's bring in CTV's Jeremie Charron. Jeremie, thanks for joining us as always. And let's talk a little bit first about what exactly is walking pneumonia.
Yeah, Roger, walking pneumonia is typically a less serious version of pneumonia and is most common in young kids, specifically school-age kids. What experts are reporting this year particularly, doctors across the country, is that they're seeing an uptick in walking pneumonia cases that are more serious and at times more complicated. And they're also seeing more younger kids, toddlers, and like younger age children, even school age children. And so that is why experts across the country are a little bit concerned about this. Typically symptoms include dry cough, fever, headaches, fatigue, a runny nose, difficulty breathing, anything that kind of the typical symptoms that you would see with a respiratory virus, like other common respiratory viruses that we typically see this season. Where experts are concerned is that they're seeing more cases that are requiring one more serious treatment. In some cases, doctors have seen that some patients have required oxygen for their difficulties in breathing. And some of the symptoms are showing up quite differently as well. These are rare cases, but in some cases, they're seeing symptoms like rashes, heart issues, brain issues. The challenge with walking pneumonia, experts say, is that it can take on a number of different symptoms. Doctors call it the great imitator. So it can be hard to identify sometimes, and that is part of the challenge, but certainly a concern that experts and doctors across the country are raising this season is the severity of walking pneumonia, but also the fact that they're seeing cases in younger age children as well.
Absolutely concerning. Any indicators as to what's leading to this?
It's not exactly clear, what the cause for this uptick is, or kind of the change in severity and symptoms in age of some of the people that are contracting this. What experts do say is that it is in line with what they're seeing in the U.S. There's been a similar trend in the U.S. Part of the challenge, though, is that this is not a reportable disease in Canada. It means it's not constantly tracked as some other respiratory viruses are. COVID-19, the common flu, influenza. Those are kind of more popular respiratory viruses that are tracked, and the data is easier to obtain on. And so part of the challenge is testing here, and sometimes results can take some time to come back. So it's not exactly clear why there has been an uptick here, or like I said, a change in the severity of some of the symptoms. But certainly doctors are just saying to keep an eye out. For the most part, most people that get walking pneumonia, rest, lots of fluids is enough to recover properly. But of course, the more concerning cases, Roger, as we mentioned, are some people that are ending up in hospitals, sometimes needing oxygen, and sometimes suffering from some more serious symptoms.
Okay. CTV's Jeremie Charron, thank you for that.
Anytime.